My friend, so you and I get to see each other at all these conferences. I'm seeing you rotate at AVAMed, at all the Mayo events, right? So you're like an Aussie transplant in the US right now.
Yeah, it's going well. We've been making a purposeful effort to sort of be here and show our presence in the US and commit to the market. So here we are.
And for those that aren't following Optiscan or just are living under a rock somewhere, I think you've had a pretty meteoric rise, and I'm not meaning that in a short time, because I know this has been a long-term effort for you as a PhD, and I think I've shared with you as a friend and also a client partner, like you are the most un-PhD I've had the chance to work with as a CEO, so that's a compliment, backhanded, yeah.
Thank you.
But the Optiscan journey.
Optiscan journey. The Optiscan journey is 30 years in the making. It's that overnight success, 30 years in the making, right? The tech spun out of an Australian university, perfected over time, and really we're just getting our act together with how we transition that into something that is useful in the health sector. The technology has always been there. The application hasn't really actually come of age. Now it has.
Yeah. So you're a technology that was spun out of university. You saw the commercial validity in it, and you've been on a mission now for a couple years since we've known each other.
Correct.
And we were chatting about that, the amount of time you're spending here in the U.S. versus Perth, Australia.
Correct.
And is it because certain platforms are starting to see traction that you think that the technology can bridge and make them a stronger platform?
Yeah, it's at the beginning, it's really us recognizing what is the capability and the power of the tech, understanding where the sector is going as a whole and where the gaps are, and where we can value add and really bring either another platform or another technology to better use or more prominence. We're in the digital pathology, surgical precision space. We bridge the gap between surgery and pathology. That's been a key for everyone else understanding what we do, because now we better understand where we fit into that continuum, into that workflow. So the timing is also right. Digital. We're digitally native, and AI, couple that with visualization, what's happening in robotics, where surgeons want to go, the massive change occurring in digital pathology, the back end, we're sort of trying to bring that to the front end. I think it's just the right timing.
Now for our audience in digital pathology, classically what would happen is you'd have to take a biopsy, put it on a slide, send it to the lab, wait for it to come back, get an output on it, we have a decision we have to make, we move forward. Now with your platform, we're able to take that optical bundle, get down to the site of let's call it
any tissue.
Your
surgical site. Yeah.
And you explain it, and you are able to determine pathology right there live.
Yeah, so essentially it's very simple. We're a point of care digital pathology platform. Imagine you've got a microscope now at your fingertips. And whatever a surgeon ever wanted to do on the spot while the patient's on the OR table, now they can do. So yes, we can see live tissue at microscopic grade, so 1,000 times what we see with CT, more than what we see on a traditional microscope. But we see it live, we see it immediate, we see it at point of care, we see it where we can make decisions, where surgeons want to make decisions, but also we see it where pathologists want to help their surgeons make decisions, better outcomes for the patient. And of course, affects the workflow. Tremendously. There's a lot of savings to the health system. You're doing all of this up front, and you're doing it without having to take a biopsy, without having to send it to the lab, without having to wait for that glass slide to be generated, and then to scan that glass slide. So we're front-ending digital path, not just following the others, I guess, in the back-end digital pathology.
So will I need another specialist in the room with me, a digital pathologist, in order to read, or will I get that information as a surgeon based on some other capabilities?
So you will get the information as a surgeon at point of care. Obviously there's a little bit of training because surgeons aren't pathologists and pathologists aren't surgeons. We can bring the pathologist to you. Of course, we'll bring that to you digitally. So we will truly bridge that gap between the surgeon and the pathologist through the cloud. So we've built the platform to basically be generating DICOM images, which is the standard in radiology. It's PACS enabled. You can plug it into your system anywhere in a lab, a hospital, what have you, like radiology. Think of our digital pathology machine as another CT scanner sitting in your hospital. And now we can transmit those images to your pathologist anywhere in the world through the cloud. We've built our own software to do that, what I call Netflix for pathology, so we can stream it to you. And we're building AI tools to help both the surgeon and the pathologist to determine in a faster fashion with a little bit more accuracy what they're looking at. So that dichotomous cancer, no cancer, for example, if I'm doing a resection, just to make everyone's life easier. So those systems, software built back onto that hardware capability upfront.
You and I were chatting yesterday when we got to catch up with each other, that this is that era of medtech where we're getting physical AI involved, where now you're able to, where classically when we think about robotics was a deterministic sort of art in itself, right? Clearly classic physics. But now we're introducing a hyper-intelligent advisement at the tip of the spear.
Yes.
That now changes almost the entire decision-making process and the economics of that. That is where I think we start to see things will change, autonomy will change.
Correct.
If you now give me that physical AI on the end of a sensor, I can start to move into autonomous.
Correct.
At that point in time.
Correct. I mean, we joke when we talk about, imagine your job as a surgeon is to have a cup of coffee on the side, not even looking at the console, where you've determined where your resection should be. We've mapped out exactly what's residual cancer and what's not, and the robot is doing the surgery for you, because we can tag cells with molecules that fluoresce. So now you bring the best of molecular genomics and all the biomarkers that are coming through with robotics and visualization through our capability at that sub-micron level. That's the future. And you're targeting that per case, per patient, precision medicine, precision surgery at your fingertips. The surgeon's just sipping a cup of coffee on the side.
But they are the coach who's determining the pathway forward.
Correct.
They're determining the tools to be used.
They're the planners.
They're the planners.
They're the planners. The tools are just there to assist them. And we still believe digital pathology is not doing enough for the surgeon. So their kit is not full. We want to make sure that that kit is absolutely full. So we're bringing that pathology capability to where they want it, where they need it.
And then finally, you can deliver that capability in a small package?
Very small package. So currently our probes are 4 centimeters long, 3.5 millimeters wide. We've got some further R&D where we're miniaturizing that even further to about 2.5 mil, 2 centimeters long. And as I say, we can get into any nook or cranny anywhere. So we can basically follow that with a flexible scope, a rigid scope, laparoscopic surgery, robotic surgery, you name it, the possibilities will be there for them.
And the fidelity of the data is as high as what comes up the slide?
As high as standard H&E, and that we guarantee, and that's where we're different. There are imitators, there are cheap versions. You will not get the resolution that you get with our system, and that's what makes the AI possible. It's the typical thing of crap in, crap out. We give you the resolution that you get with a standard microscope. I would say a touch more. With the capability of then embedding true AI and assisting that operator, clinician, surgeon, pathologist, exactly how a glass slide would be used, but at point of care.
Wow, that's amazing. Well, I know you and I are going to be together. I think you're giving the keynote at Mayo at the beer summit, aren't you?
Looking forward to it, really looking forward to that.
Yeah,
It's a
that's
great
going to be a
opportunity.
fun one.
Great fun opportunity.
I'm excited for you and I'm excited
Thank
for
you.
the industry.
Thank you, and thanks for your help.
Always.
Thank you, always. Thanks.
I'm Joe Mullings from the floor of the AdvaMed MedTech Conference 2025. Be well.